Hello, my amazing team. I trust everybody is doing well. So, I just want to talk about some menstrual disorders. These are just few problems that some women experience during their normal period. Okay, some people have taken it as normal pattern, but it's not really normal. It's a disorder. So, let's talk about few of them. These are more reason why a lot of women visit gynecologists. One is what we call dysmenorrhea. Dysmenorrhea simply means painful menstrual cycle. You are having a lot of pains, cramps during your menstrual period. Number two is what we call the menorrhagia. Menorrhagia is heavy bleeding. You are bleeding a lot. Sometimes you might even see some clots whenever you are having your period, or your period might exceed 7 days. It's not normal, it's abnormal. Number Number three is what we call metrorrhagia. This is a situation where you have irregular periods. Your periods comes in irregular pattern, like irregular intervals. Sometimes you see your period coming in between your periods. You're expecting a period to come maybe in 20th of January and you end up seeing it on the 15th. Is irregular, okay? It's called metrorrhagia. Then we will have what we call the oligomenorrhagia. This is a situation where you have infrequent menstrual cycle. You will see one in January and see another one in April. Another one might come in September. Is infrequent. That one is called oligomenorrhagia. Okay, people that are mainly experience oligomenorrhagia are people that are about to enter their menopause. Okay, we have what we call the amenorrhea. Amenorrhea, from the name amenorrhea, there's no period, there's no menses. You don't experience any menses at all. You might experience amenorrhea maybe towards your menopause. When you are in perimenopausal stage, you might have some amenorrhea before you finally attain menopause. So we still have what we call the premenstrual syndromes. Some people, whenever they're about to see their period, they will have a lot of physical, emotional, psychological problems. Some people might have mood swings, some people might be depressed, some people might have a very low mood. You can't just explain their mood. This is what we call premenstrual syndrome. It comes before period. All right. Then we have what we call the hypomenorrhea. Some people, their period is very light. It can just come maybe for 1 day or 2 days, it will disappear. It comes in a light form. This is what we call hypomenorrhea. So these are just the few disorders that are related to menstrual cycle. Do you understand it? So let's just talk about the causes of menstrual disorders, the symptoms you will experience, and also the treatment options available. Okay, one of the cause of menstrual disorder is uterine fibroid. Okay, whenever you have uterine fibroid, it might affect your menses or it might affect your cycle. Then hormonal imbalance. If you have hormonal imbalance, it will affect your menstrual cycle because menstrual cycle is regulated by hormones. Okay, if you have a polycystic ovarian syndrome, you will also experience menstrual disorders. It's normal with you. Right, we have what we call genetic factors. Some of these disorders goes in genes, right? So you might experience it because your mother or your sisters experienced that. Sometimes you might have it because of clotting disorders, right? Some clotting problems might cause you to bleed too much, might cause you to not to bleed at all. Is also a factor. Then your diet. I've treated some food that you need to avoid during your period. Some food can aggravate these disorders. So you have to be mindful of what you eat during your period. You can still watch my video on that. I've done video about things you should eat and things you should avoid. Then talking about your symptoms, of course, we know that symptoms you will experience is heavy bleeding. If you have menorrhagia, you experience heavy bleeding. You may have mood swing, you may have low mood, you may be depressed, you may have emotional disorders if you're having premenstrual syndrome. Okay, you might even have cramps, abdominal pain if you're having dysmenorrhea. These are few symptoms you experience if you're a lady. Let's talk about treatment options. Of course, diet comes number one. Right, some of these menstrual disorders can be, alleviated with common diet. Reduce salt intake, reduce sugar intake during your period, reduce too much of chocolate, all these sweet stuff. Reduce them. Reduce too much of fatty food, unhealthy fats. Reduce too much of takeaway food. All these small food that will add too much calories, sugar, and also salt, sodium chloride in your diet. Reduce them. You will see that you get some relief from the symptoms. Okay, then talking about medical treatment, it all depends on you, what you want. Do you want the cause of the problems, and do you want to be pregnant again, and other factors? These are the things gynecologists will explore before they will say this is the way to treat them. Some of them, whenever you give them hormonal contraceptives, they will feel okay. Some of the disorders will be corrected. So it all depends on the severity of your problem and then your expectation if you want to get pregnant or other stuff like that. Some people can as well take some pain relievers like paracetamol, ibuprofen to get relief.